I'm Dr. Bolanle Adegboyega. I'm an MBBS holder in UCH Ibadan. I'm also a fellow of National Postgraduate Medical College of Nigeria, a fellow of West African College of Surgeons. I'm a fellow of IAEA, International Atomic Energy Agency. I did that in CDH, Zambia. I'm a fellow of UICC. I did that in MSKCC, New York, US. I'm the head of brachytherapy unit of NLCC, NSIA-LUTH Cancer Centre. I'm a clinical and radiation oncologist. I'm a member of HACON, that's the Association of Radiation and Clinical Oncologists of Nigeria. Being an oncologist takes more than being a doctor, more than making money. There has to be an empathy part of it because of what it takes to treat cancer patients. There's a place of burnout, there's a place of depression, there's a place of almost wanting to lose it. So I say in my case, it's more of a calling. I actually know I'm to be in this field, and I'll say so far so good. I enjoy being an oncologist. Well, like I said, there have been times that you have been so attached to a patient, and losing a patient takes a whole lot. So there's a place of getting burnout, getting depressed, and then death of patients actually getting to you. So it can be very challenging. So I think it's more of an emotional thing. Maintaining a healthy work-life balance actually is very important and key to this as specialty. Why? Because you tend to see some depressing cases. It could be very sad. So if care is not taken, there will be burnout. So in that case, I'm very intentional maintaining a healthy work-life balance. Essentially, when I'm at work, I give it all my best. And when I'm at home, as much as possible, I try to shut down so that I can face my family, because I'm also a mother, I'm a wife, I'm a daughter, I'm a daughter-in-law. So there's still so many things to it than just being a doctor. So I try to apportion appropriate time to everything. So during my free time, I love traveling as much as possible, and then watching movies, I love exploring. So as much as possible, when I'm free, I maximize that. Generally, women in any field, there's so much expectation from you, and then there's so much that you have to deliver. At work, you want to be on top of your career. As a wife, you want to please your husband. As a mother, you want to be there for your children. And then you also have other things. You have your God factor. You want to be a good in-law. You want to be a good daughter. So there are like 5 or 7 things expected of you as a woman. And at the same time, you have contemporaries that are males that don't have so much. So for you to be able to strive to be the best you can be is actually a major challenge. And so you just have to be able to balance it well so that none of it is suffering for the other. Well, I'll say brachytherapy generally, it's especially the commonest we do in Nigeria. It's gynaecological cancer brachytherapy, in cervical cancer and endometrial cancer. This is also a disease that is it's a disease of women, and it's the second commonest for women in Nigeria generally. Abroad, it's a vaccine preventable cancer. Unfortunately, we are not there yet in Nigeria. So when you see women suffering this, and it can actually be cured, one of the few cancers that can be cured, especially when it's detected early. So in NLCC, we offer 3D brachytherapy, that is image guided. We're about the only center in Nigeria offering that as of now. So it gives me joy when you know that as a woman, you can actually treat a fellow woman and you can achieve a cure, especially when they come in early, knowing that you can actually get them to have a good life even after this challenge and then be what you want to be. So in Nigeria, NLCC is at the forefront of image guided or 3D gynecologic brachytherapy services in Nigeria. So it's actually is about the best method for now. We're just short of it a bit. So it's about the best method worldwide now. So we can probably say that we're offering the best treatment for gynecologic cancer in Nigeria as of today. Okay, like I mentioned, I just acquired 2 fellowships recently in gynecologic brachytherapy. That's in 3D gynecologic brachytherapy. So essentially what we do, like most of my other colleagues, is that we try to, learning does not stop. We keep learning, keep acquiring new knowledge, go out of your way, learn online, learn on site. So I was at Cancer Disease Hospital in Zambia last year, sponsored by High Fellowship with some other people in Nigeria. And then there they do both 2D, that's common in Nigeria, and 3D, that is what we are doing now. So we're able to see the transition, we're able to learn on site. Then I was also at Memorial Sloan Kettering Cancer Centre in New York in the US, also to learn about 3D gynecological cancer and brachytherapy and then prostate brachytherapy. So essentially what we do, and there are quite a number of courses that we also have partnered with, that we can exchange ideas, going there, getting knowledge, and then being the best you can be even in your field. Well, like I so much believe in women. I'm happy I'm a woman, and they just tell us that for women, the sky is not even our limits. And then at the same time, you can still be the best you can be in your career, in your profession, and your family, and even the church of God or your religion or your faith does not suffer for it. Okay, so for women generally, the sky is not even your limits. You can be whatever you want to be. Just put your mind at it. Career-wise, your family, your religion, your faith. And then, like I tell people, my best is yet to come. Watch out for that girl. The sky is not our limit.